Donald Trump and Republicans have shut the government down because they don't want to provide health care to working class Americans.
All right, let's break this down. First off, Donald Trump and the Republicans did not shut down the government. The clean continuing resolution passed in the House. Donald Trump is ready to sign it. Democrats are using the filibuster in the Senate to stop this from happening. The filibuster essentially means that senators can end debate on a topic indefinitely. And in order to break past the filibuster, you need to have 60 votes in the Senate. So Democrats are quite literally causing a shutdown because they want more spending on healthcare. But again, a clean continuing resolution is already passed in the House. Democrats are blocking it in the Senate. When I say clean, it essentially just means that they're going to continue to fund the government at its current levels just to keep the lights on. No policy change is not adding anything, just keeping it clean to keep people paid and keep the government operating. Democrats are saying no to that, and they're trying to use that as leverage to get policy changes because Congress controls the purse. So they're using this continuing resolution as leverage to get what they want. They're trying to jam their policies into a resolution to keep the government running. But now that I've said that, let's go back to what Hakeem Jeffries said again. I addressed the first part. Democrats have essentially stuck a piece of metal in the gears that were turning and are now blaming the gears. But let's get to the second half of what he said.
Donald Trump and Republicans have shut the government down because they don't want to provide health care to working class Americans.
That's a lie. We already addressed how they didn't shut the government down. Second off, he does want health care for working class Americans. They're talking about the cuts over the next 10 years that are happening with Medicaid. Now, mind you, around 90% of people are still expected to be covered. Do you know who the number one target of these cuts are? Able-bodied adults aged 19 through 64 without disabilities, dependents, or other exemptions. They are increasing work requirements for these individuals in order for them to qualify. If you don't have disabilities, children, or any other exemptions, why shouldn't you be working at least 20 to 30 hours a week to contribute to our society? You're just supposed to be able to sit back, not do anything, and then reap the rewards from other people's work? So no, Donald Trump very much wants working class people to be insured. He doesn't want people mooching off the system, and I don't blame him. Also, of our federal budget, about 13% of it goes to just interest on debt. Just for context, Medicare is 14% of our budget. So 13% of our budget is going to interest payments, and that rate is accelerating. So the government has to do something to get this interest under control. If they don't get interest payments under control, our government will spend more and more money on interest payments, and we won't have money for all these entitlement programs or our defense. So the government has to figure out a way to take on less debt and having more money to take on interest payments. The money has to come from somewhere. They're looking after the financial health of our nation.
Mike Johnson is being exposed because people in his own district are going to have their health care premiums raised by 300% because of this government shutdown. Keep in mind, he has one of the largest Medicaid populations in the entire United States, and he's trying to take that away from them.
One of the examples you've put out is in Speaker Mike Johnson's Louisiana district, a 60-year-old couple earning $82,000 a year. Their health care premiums will rise by almost $20,000, by 300% because of what their congressman is doing.
For a middle-class couple making $82,000, a $20,000 increase for their health care is a huge deal. We're talking groceries, mortgage payments, retirement savings gone. And that's all because their congressman, Mike Johnson, is playing political games. And the irony here is brutal. His district represents one of the largest Medicaid populations in the entire United States, so the people who voted for him voted directly against their own self-interest. And the worst part is this won't just affect people on Medicaid or Obamacare users. This will also impact people on Medicare, as well as those with private insurance. They will see their prices go up too. This is an across-the-board attack on affordable health care. Also, the Republicans can afford their massive multi-trillion-dollar tax cuts for the richest Americans. These shutdowns aren't abstract issues. They're not just about budget fights or political talking points. They have real-world consequences. When people can no longer afford to go see a doctor when they need to, they will undoubtedly lose their lives.
Everyone, it's Lick. Welcome back to Licker's Take. We are now more than 17 days into this government shutdown, and things are getting angry. Hospitals are struggling to stay open. Families are losing their health care, and premiums are shooting through the roof. Meanwhile, Donald Trump and the GOP are acting like this is just another political game, but it is not a game. And people's lives are on the line. We got more video like this. Let's watch it. I'll come back with a comment. Let's get into it.
So I'm finding out that Trump supporters are upset because they're about to lose their health care and their insurance, and their children that are under the age of 26 are about to be kicked off because they voted to repeal the Affordable Health Care Act. And they didn't even realize that they were doing this. And I'm going to pretend that they're not racist and they forgot that.
I pulled a Republican aside on the floor. And I said, hey man, there's no cameras around here. I just want to understand. Like, I'm not here to put you on blast in front of a camera. Just person to person. I genuinely want to understand, because people think that trying to understand another person means that you agree with them or that you're being soft on them. And it's a huge problem in this day and age, because that mentality really prevents people from being able to connect and persuade. But I pulled this guy aside and I said, hey man, like, I know that you represent a couple of rural hospitals, and this bill is going to devastate rural hospitals. I just want to know from your perspective, are you worried about that? What are you thinking about with your hospitals and your people? Because a lot of people don't know, like a ton of ACA recipients are in red states. A lot of Medicaid recipients are in red states. These are like Trump voters that are almost disproportionately, in many circumstances, being negatively affected. And so I said, like, walk me through how you see this. And he was like, yeah, I just don't believe it. He's like, I know that you guys need to make a big deal out of this to like score political points, but I just don't believe it. And I'm kind of sitting here like, this data shows that this bill is going to devastate a lot of people. But a lot of these folks just like don't believe that data. You know, there was one hospital in one of these districts. I was like, yeah, we might have to close. And they are now on their back foot. Like, they thought this was just a Democratic talking point. And now that their own people are being affected and their own hospitals are warning them, they are now kind of low-key panicking.
Hello?
Hi, Ann, it's Cory Booker.
This is Laura.
Hey, Laura, it's Cory Booker.
Oh, hello, Senator Booker. Hi, Senator Booker.
I'm just grateful to you for your willingness to talk with me today and talking to my team about what's going on in your life. But I would love to hear more about it myself.
I'm sure you know that in New Jersey, the child care assistance has been cut.
It's like the double whammy of childcare. It becomes more expensive where you would need to work more, but at the same time, without childcare, you have to stay at home and then forego income altogether.
In 2007, my son was born, and he is on the autism spectrum. My son's needs were also increasing. It became harder and harder and more untenable for me to continue working full-time. We're seeing delays sort of in processing for Medicaid coverage and public housing and utilities and medical transportation.
Well, what about the prospect of the ACA subsidies not renewed?
For the families that we serve, that will most certainly mean no coverage. And because my economics have changed, I am one of those people who've benefited from significant federal subsidies.
Right. You're stepping up for your child in extraordinary ways. And so the prospect of these premiums doubling, tripling is staggering to me. What is being visited upon us is an American nightmare right now. This is what Republicans are forcing. I want to do everything I can to elevate the stories of people. Please go to my website and share your story.
You've probably heard the bad news. A Trump government shutdown may be on the way. And you're probably asking a very important question. Why? I'll tell you why. Republicans want to shut the government down over one thing. That's your health care. Here's what's at stake: the cost of your health insurance. If you get your insurance on healthcare.gov or ciudadanodesalud.gov, you receive a direct discount. Your premiums are already high, but they are actually lower than they would be thanks to a cut to your monthly bill. That discount is the Affordable Care Act's premium tax credits, and Republicans want to take it away. If we don't renew these credits, then on November the 1st, you'll log into healthcare.gov to renew your plan. And let me tell you something, these numbers that you'll see are going to shock you. In many cases, your monthly bill will go about $1,500 a month in 2026. That's tens of thousands of dollars more a year. And these discounts go directly to you, working parents, small business owners, and early retirees. In Texas, that's 4 million of you. In the district I represent, almost 100,000 constituents rely on this tax credit to keep your coverage affordable. And let's be honest, even with the premium tax credit, your monthly premium is still too high. Imagine if Republicans allow that tax credit to expire. Man, they are going to stick you with a huge bill, and they'll force you to choose. Do I save tens of thousands of dollars, or do I buy health insurance? For many of you, that means a brutal choice between paying the light bill or affording your insulin, buying groceries or getting a checkup, expanding your small business, or access to cancer screenings. And you absolutely should not have to make that choice, because without health insurance, if you get sick, you cannot get the care that you need. And what's Trump's plan to lower your health care costs when these tax credits expire?
We have concepts of a plan that would be better.
Come on, Republicans, we're giving you the opportunity to help Americans keep their health care costs down. So I want to be clear about one thing. If a government shutdown happens, it's because Republicans and Trump want to fight for billionaires and Democrats want to fight.
How can I call this? What is a power grab? Donald Trump has shut down. It is not about protecting Americans. No, it is not. It is about controlling them. They are cutting programs, laying off workers, and driving up healthcare costs, all while pretending it is someone else's fault. He can lie all day about healthcare for illegal immigrants, but here it is the truth. Americans are the one who losing coverage. Hospitals, especially in the rural towns, are being forced to shutting down. Families are skipping medication because they can't afford it. Can you imagine? And the premiums, in some places, they have doubled the price. You know, serious. Even Senator Cory Booker says from his office he's getting non-stop calls from people who can't afford healthcare anymore. Every day, this shutdown is pushing more Americans to breaking point. And what are Republicans doing? Nothing. They have left the town while the country breathes. Can you imagine? All of this chaos just protect billionaire tax break? That is not leadership. That is clothing. We got another one. Let's watch it. I'll come back with a comment.
So if you've been paying attention to any of the details of the Chuck Schumer shutdown, you're probably asking yourself, what in the heck are these people talking about? Because the Democrats continue to change the narrative. And over the last 2 days, they've started talking about this concept of wanting to protect Americans from their health care costs increasing. What on earth does that mean? Well, first, it's important to understand that they just started using this new narrative right about the time that they started to understand that the American people were not going to budge on giving them $1.5 trillion in new spending to fund things that we've already told them no to. So instead, now they're talking about keeping healthcare costs low. But what on earth does that mean? You see, what they don't actually want to tell you is that the American people are getting ready to hold them responsible for selling us a bill of goods with Obamacare, because it's collapsing within itself in a major way. See, back in 2021, the Democrats tucked in a massive subsidy to keep Obamacare afloat because there wasn't enough enrollments. They only had about 12 million people actually enrolled in the program. So as part of the Inflation Reduction Act and a few other bills, they were able to remove the income caps on eligibility. And they basically were just encouraging everybody to enroll in the program. And they were funding almost 90% of it. The problem is they were only able to get that subsidy in place for 4 years. And those subsidies are ending at the end of this year. So what does all of that actually mean? Well, if the federal government is not massively subsidizing Obamacare, people are going to realize that it was always a smoke and mirrors job. It was never designed to actually lower the cost of health care. It was designed to be a handout. That's right, an entitlement program. Exactly what we said it was going to be back when they were originally debating it, and Obama jammed it through. Do you remember that? And now that the subsidy extensions are getting ready to expire, they realize that the American people are going to lose our ever-loving minds when we find out just how expensive Obamacare has been and how destructive it's actually been to the cost of health care. But what they're really terrified of you finding out about is the reality that anywhere from 1 to 2 million of the increased enrollees since 2021 are coming from the people that Joe Biden allowed to cross the border, gave them temporary protected status or asylum protections. They enrolled in Obamacare, and you're paying for it.
So with this Donald Trump and MAGA Republican government shutdown, because they don't want to extend the Affordable Care Act subsidies, Democratic leader Hakeem Jeffries did something which I don't think we would think should be political or controversial. He posted a video that said, "Save healthcare." And then it went on to talk about how hospitals will close, monthly insurance premiums will double. It got over 2 million views in the first day. But Leader Jeffrey says Republicans have created a healthcare crisis in America. We must decisively address it. And then the words flash, "Save healthcare." To which then MAGA Republican Congress member Tim Burchett responds, "We did not create Obamacare." Then MAGA Republican Congress member Mike Lawler, very critical of this video that Hakeem Jeffries posted that just says "Save healthcare." Lawler goes, "Obamacare was passed by Democrats. The Obamacare tax credits were passed by Democrats during COVID and slated to expire at the end of this year. 3, since Obamacare took effect, healthcare premiums have risen."
Remember when Trump said that he wants the government to run like a business? And now American farmers are going bankrupt and need a bailout? And average American citizens are worried if they can afford their health insurance? Oh, and inflation is going up, so everything costs more, which means that the average American is saving less. Oh yeah, and now the government is shut down. So this is all kind of like Trump's businesses, when he bankrupted 6 casinos, and don't forget about Trump University, and Trump Steaks, and all of the other failed business ventures with Trump's name on it. So I guess when MAGA voted for Trump, they wanted the government to run like a real business, not like a Trump business.
I feel like the Republicans have just completely lost it. And the reason I'm saying this is because I just found out that one of the reasons why the Republicans are shutting down the government is because they want to continue cutting healthcare to Americans. Now, you see, the funding for the federal government to continue running just ran out on September 30th. And Trump comes in here and is just like, "Oh, that's okay that the government shut down. I don't want to negotiate on a new bill anyways. Just pass it without Democrats." So instead of just coming to an agreement, the White House is telling federal agencies to prepare plans on firing federal workers if this shutdown continues, which honestly feels like punishing everyone else instead of actually fixing the problem. And the reason we keep ending up here is because Congress doesn't pass full budgets anymore. They keep passing continuing resolutions, which is basically like putting a band-aid on the problem and pushing it down the road until it blows up again. It's like the Republicans put the Democrats in a hostage situation, and the stakes are the American people. So yeah, here we are again in another shutdown. I don't know about you guys, but I'm sick of going through this over and over again.
I will never in my life, Dan, ever vote for a Democrat, ever.
What is Trump's healthcare plan?
Off the top of my head, I can't remember right now.
What did he say in the debate with Kamala Harris when they said, "What is your healthcare plan?"
I don't.
Donald Trump said, and I quote, he said, "I have concepts of a plan." And right now, as Republicans criticize Democrats and say, "We're not going to give illegals health care," which is a lie, Republicans are being asked, "Hey, do you have a health care plan to replace Obamacare if Obamacare and the Affordable Care Act is so bad?" And what do they say? No, they have concepts of a plan still. So when you say you picked when you
Affordable
say you
Care Act,
elected Trump, just really quick, when you say you voted for Trump based off his policies and better plans, and healthcare is a big thing to me. I know people who suffered from cancer, Alzheimer's, who suffered from different forms of like dementia, suicide, drug, alcohol abuse, all that kind of stuff. They needed a lot of help in my life. I knew a lot of people going through a lot, including some veterans, including people, firefighters, police, a bunch of social workers, whoever it might be. Healthcare is a big deal to me. The fact that Trump said, I have concepts of a plan, and at this point, after being president for damn near 10 years, he has no healthcare plan, and you say you voted for Trump based off his plans, do you see how that's kind of funny sounding?
Okay. Keep listening to CNN and Kamala.
Sir, respond to the points I just made. Why did Trump say he has concepts of a plan and he still has no healthcare plan?
It takes a while to get through the. Right now, he can't even get the budget put on because the Democrats are stopping it.
So he doesn't have an idea of what healthcare can even look like. Even running for president, he was running for president for like 4 years. He was banned from Twitter, so he had no time to tweet. So we're done. Wow, he said we're done. What a whiny little bitch, bro. What a whiny bitch. Honestly, dude. Shout out to women, but bro.
At this point, it's clear. This is not democratic shutdown. This is Republican-made health crisis. And the longer it continues, the more Americans will pay the price. Sure. And people from US say you should speak out and share what is happening because silence is exactly what they are counting on. They want you to keep quiet, but you have to raise your voice, guys. My name is Lick, and this is Licker's Take, and this is not politics as usual. This is people's life, and we can't afford to stay quiet anymore. Guys, thank you for watching. I hope you liked today's video. See you on another one. I love you guys.